fibrin adhesive. This is a two-component product which we purchase and use to help the fibrin cascade. So that's the thrombin formation cascade that occurs with healing. Now that sounds very technical, but as you realise that when I do your upper eyelid surgery and your lower eyelid surgery, I have to cut through the skin very delicately to remove a little bit of it. And then I have to reposition these skin edges together. So I have the option of using stitches, or I can use entirely tissue fibrin adhesive, or fibrin adhesive as it's more commonly called. And I can use that, it's like a glue, but it isn't a glue, because it relies on contact with your fibrin that occurs in the wound to cause the coagulation and just beautifully seal that wound very quietly. Helps it be a very nice quiet wound, and it helps the healing. It also gives you a wonderful appearance afterwards because you don't have hardly any sutures, or you have very few sutures. In the year 2003, I applied to the ethical committee at St Mary's Hospital, part of Imperial College, to do a randomised controlled study of tissue fibrin adhesive with wound closure with ptosis and upper eyelid blepharoplasty, in other words, with eyelid surgery. And we did about 30 patients in whom we used it with just very, very few sutures. And we had 2 masked observers who looked at the healing photographs afterwards and found that they were as good as stitches, or in fact slightly better, and had a very good patient satisfaction for the wound healing and the recovery afterwards. So this is something I was the principal investigator of, and I'm pleased to say that I'm one of the few people that are able to use this. We weren't able to use it for a few years because it was prohibitively expensive, and it was quite complex because we had to mix the 2 products together. But now the prices are more reasonable for patients, and it's more easier. It comes pre-mixed, and so we're using it a lot more. And our feedback from our patients is that they're very pleased by not having to have a lot of stitches. It means not so much time spent underneath the surgery and a quicker recovery.